Elrexfio is an innovative treatment for multiple myeloma.
It's been one of our most exciting types of medications that has allowed people who previously had very limited options to have a new opportunity for a new treatment that works very well.
Elrexfio and other bispecific are definitely groundbreaking, and I think we're very fortunate to witness this in multiple myeloma.
When patients tell me that they're on a medication that treats myeloma, like Elrexfio, and they tell me they forget they have cancer, to me that's just phenomenal.
It's just wonderful. I don't have to think about cancer or my treatments. I get on with my life every day.
14 years ago, Frank Cassani was diagnosed with multiple myeloma after a routine physical revealed irregularities in his blood count.
I had no idea what multiple myeloma was. I knew it was a cancer, obviously, but I did not know what type of cancer.
Multiple myeloma is a blood cancer that affects the bone marrow. More than 160,000 Americans are currently diagnosed with this disease.
Multiple myeloma is a cancer of what we call the plasma cell. These are the cells in our bone marrow, which is really the factory of all of our blood that makes our antibodies. So now these plasma cells, they grow and grow and grow, and they start making bad antibodies. Those bad antibodies now can attack our kidneys, can attack our bones. It doesn't allow the rest of the factory to work well.
Frank was 64 years old when he was diagnosed with myeloma.
It was quite a shock, and I was dismayed and thought, why me? But I got over it and got on with my life.
Despite his diagnosis, Frank continued to lead a fulfilling life as a father, electronics engineer, and also enjoyed numerous hobbies.
I had actively involved myself with groups for bicycling, swing dancing, and scuba diving every weekend.
Frank has a very positive attitude about living with his cancer, with the myeloma.
Frank's wife, Carol, not only enjoys sharing an active lifestyle with Frank, but once he started to undergo treatments for myeloma, she was always by his side.
We'll start out this morning with labs as usual, Carol. And then,
Right, I mean, last time your labs were perfect, you know?
Yep.
You're in great shape. My role is really to be supportive. I try to go to all of his visits because I think it's important for us to do that as a couple.
Carol's been a wonderful partner in my myeloma treatments and was wonderfully attentive and just a godsend to have there with me during my bad times.
Over the course of 14 years, Frank had a number of different treatments for his myeloma, some harder and much more time-consuming than others.
My very first treatment was a pill, and that was quite simple, but all the others were quite involved, and yeah, they were not pleasant to deal with. I'd go to the hospital weekly or every 2 weeks and sit in a chair for 4 to 6 hours for my infusion. And you definitely feel like a cancer patient because you're in the hospital quite a bit and for a long period of time. You know, the game with cancer is you take your treatments and you just get on with your life as best you can.
But in the spring of 2024, Frank's myeloma returned.
My blood labs had indicated I was moving into a situation where my cancer was coming back, and we wanted to take action quickly.
We weren't expecting it to return when it did. And it kind of was a whammy, like it's here, and it came back in force.
Frank's oncologist, Dr. Rashid Baz at the Moffitt Cancer Center, recommended that Frank try a new drug called Elrexfio.
Currently, it's for patients who have received 4 prior lines of treatment. In drug development, a lot of times a medicine is first investigated in more advanced forms of the disease.
But we're now doing the clinical trials in earlier line therapy, which will eventually bring the drug even to frontline therapy. Elrexfio is part of a group of treatments we call immunotherapy because we engage a patient's own immune system to attack their myeloma. Let's talk a little bit about how elranatamab or Elrexfio works. This is the myeloma cell down here, and it has these things that stick out of it that are called BCMA, or B-cell maturation antigen. Think of it like a hook or a target on the outside of the myeloma cell that can be grabbed onto. Secondly, we have a local T cell here. T cells are our soldier cells that can help us fight off infections, or in this case, be able to actually fight other cells. It's called a bispecific antibody because it has 2 arms. One arm hooks onto the T cell. The other arm hooks down here onto the myeloma cell through that target BCMA, and it brings them together. And by bringing them together, it activates this T cell to try and attack the multiple myeloma cell. I think of Elrexfio as a focused treatment that is directed specifically to the multiple myeloma while engaging a patient's own immune system to take it down.
The bispecific antibody is nice because if you have somebody who's progressing rapidly, this is what we call off the shelf, where you can just write the prescription, admit them to the hospital, and that same day give the drug.
One of the key benefits of Elrexfio for patients is how straightforward it is to administer.
It's an easy injection just underneath the skin. You don't have to worry about finding a vein intravenously. It just goes right in the belly as a shot.
It's a quick, simple procedure. I can go about my life without even thinking about it.
Hey Frank, hey Carol, how are you doing today?
Good. Good to see you again, Beth.
Yeah,
Good to see you.
How you feeling?
Great.
All right,
Yeah,
anything?
no problems, no side effects.
The visit to the hospital usually has some lab work, but it tells them what's going on. And then he usually sees a nurse to kind of go over how he's doing, if the meds are working, if there needs to be any other change.
This is the one flat line in medicine I like, when our light chains are nice and low.
Great.
So this just means that the disease is responding.
Many centers now fully administer bispecifics in the outpatient setting.
When the drug is being administered, the approach is to do it in a stepwise fashion.
How we're going to start patients is 2 small doses, so patients will start off with 12 milligrams, then 32 milligrams, and then finally full dose of 76 milligrams.
The concept behind those lower doses is to ensure that we reduce the risk of the patient having a reaction to the drug.
If patients achieve a complete remission or a very good partial remission, then we can spread out the dosing to an every other week schedule. This gives the patient more time away from the treatment center.
There are a lot of side effects and considerations when patients embark on this treatment. With Elrexfio, there is usually a short-term hospitalization that's required because they can have some very serious side effects called cytokine release syndrome, which occur in a majority of patients.
This is the T cells trying to attack the myeloma, and they will release cytokines, or if you want to think about them as hormones, that will result in the fevers, body aches, and being ill.
The cytokine release is like a storm of chemical activity in your body that can cause high temperatures. My first injection, they kept me in the hospital for a couple of days to just observe me and make sure everything was okay.
Your medical team will work with your care team, your social support system, your caregivers, so that they are aware also of how to watch for signs or symptoms of this reaction.
Care partners also play a critical role in recognizing symptoms and other side effects, which can include fever, chills, shaking chills, fast or irregular heartbeat, drop in blood pressure, lightheadedness or dizziness, shortness of breath, headache, nausea, fatigue, confusion, swelling, or stomach pain. While cytokine release syndrome is a concern shortly after treatment, there are long-term side effects to be aware of as well.
The side effect that I always worry about is infection with patients. I tell them if they ever get any kind of fever, they're not feeling good, to always let us know.
In the United States, in multiple myeloma right now, about 80% of patients are primarily cared for in the community by a community oncologist and about 20% in the academic setting. It is really important that there's an open line of communication between the community oncologist and indeed that academic center.
The academic center handles the first month or so. Then after that, we communicate with the doctor and get patients back closer to home. So we're really trying to get our community doctors more involved because patients want to go back home. That's part of quality of life.
Elrexfio has impressive results in patients that have had at least 4 lines of prior therapy.
In that group of patients, we saw approximately 2/3 of patients had a response, and at that, 1/3 of them actually achieved a complete remission, or the deepest response possible.
Approximately 2/3 of patients with heavily treated myeloma respond to Elrexfio, and Frank is one of them.
What I find most fascinating is not the fact that, Frank has been able to achieve a deep response, but I think it's been very durable.
Frank's been our patient for many years. When he got on the bispecific, he had a high burden of disease, wasn't feeling good, pain, but once he started to respond, he's done very well. And it's all because of the drug, Elrexfio, which has got him into a best response, which is MRD negativity.
MRD, or minimal residual disease, refers to testing that is done typically on the bone marrow to see if any tiny amount of myeloma remain when the blood tests show no more disease. MRD negative means no trace of myeloma can be found, and that's great news for Frank.
Currently, I'm in a stringent complete remission. There is no cancer cells showing up anywhere.
I'm very pleased with how this drug has treated Frank. He's got much more energy than he did with the other drugs, and his remission has been longer.
Now that I'm retired and in remission, I'm pretty active with just physical activities like going to the gym and walking. I have time to sculpt for days at a time, and of course longer travel where we've been in the past.
Now that Frank only needs to take a shot of Elrexfio once a month, he and Carol can easily plan their activities and enjoy their retirement.
To you.
To you.
To Bora Bora.
Bora Bora, yes, absolutely. From the Arctic Circle down to Tahiti, we're able to seriously be planning these trips, which we would never have even thought about doing with his other drugs.
Elrexfio gives me that freedom to just go ahead and plan trips, because I can work the treatments around a travel schedule. My initial diagnosis was a survival rate of 8 years, but I'm into, 13 years now, and going strong. I have hope for the future, yes. It's just wonderful. I don't feel like a cancer patient anymore.